everyone. Welcome to our first Facebook Live Ask the Doctor event, all about Alzheimer's. My name is George Robinson and I'm the Head of Patient Liaison Manager. I'm here with Dr. Emer MacSweeney, Founder and CEO and Consultant Neuroradiologist with us at Recognition Health. Thank you so much for joining us today, Dr. MacSweeney.
Hi George, it's great to be here and we're really excited about bringing our educational event to Facebook. And today we're going to be answering questions and providing insight into the latest developments in Alzheimer's.
So we're ready for your questions, everybody, so please feel free to submit them. But I'm just going to get started with some questions that were submitted earlier on today. So firstly, can I just ask Dr. MacSweeney, one of the main things we've found from patients that regularly get into contact with us is there's some more discussion on what the difference is between Alzheimer's disease and dementia.
Yeah, no, of course. I think this actually is a very fundamental and important question. So, in a nutshell, Alzheimer's disease is just one of many causes of dementia. And for much of the time, somebody may have Alzheimer's disease, but doesn't necessarily have dementia. So dementia itself just refers to a combination of symptoms. So it's when someone has got progressive problems with their cognition, so that's essentially their thinking ability, and it's been there for at least 6 months and there's a gradual decline, and it involves at least 2 different domains of our thinking ability. So that's examples like our short-term memory, our calculation ability, our ability to find our way around in a familiar environment, maybe affecting our behaviour, could cause confusion. So they're all different domains of cognition. So if it's affecting 2 or more of those domains of cognition, and it's also interfering in what's called our activities of daily living. So in other words, they're things that previously you could do completely independently, and now you need help. Somebody else needs to help you to do those things. So if it's at least over 6 months, it's gradually progressive, it's affecting 2 or more domains, then that fulfills the criteria for dementia. Now, there are lots of causes of dementia, from Parkinson's, MS, Huntington's disease, but as we get older, the most common cause of dementia is Alzheimer's disease. But of course, when Alzheimer's disease first starts, symptoms are very, very, very mild, and therefore you could have Alzheimer's disease, but not yet have reached the point where you've developed dementia.
I see. And what would you suggest for any member of the public out there that maybe had the initial suspicion that they had these early signs of some memory impairment that could be due to Alzheimer's disease? What would you suggest for those? What course of action should they take?
Yeah. Okay, so the first thing, as with any physical or mental condition, the first thing is to get a diagnosis, to understand what's causing these symptoms. And because cognitive symptoms or problems with our thinking ability, tend to occur gradually, and also they're very sort of like non-specific symptoms. There are many things which can cause difficulty with, for example, memory, confusion, etc. So it's very important to see your GP as soon as possible and to make sure whether or not you might have a reversible cause. So things like low B12, low folate, abnormal thyroid function, anemia, all of these things are completely correctable, but can present with the same sort of symptoms as the more progressive conditions, such as Alzheimer's disease, vascular, cerebrovascular disease. So first is to see your GP, to get a diagnosis, have some blood tests done. If you then find that there's no other cause for the cognitive symptoms, then if they're definitely progressive, it's important to seek further help. You might be referred to the memory centre, but further investigations, more sophisticated tests to find out what the cause of these new symptoms is.
And what current treatment options are available to an individual with a diagnosis of Alzheimer's?
So with the diagnosis of Alzheimer's, today there are 4 main sort of drugs on the market, which are what we call symptomatic drugs. So essentially, they don't stop the underlying disease process, which is one where our cognitive, or if you like, our thinking ability brain cells are gradually destroyed and die. And the drugs that are available today, the way they work is they help those dying brain cells to behave more efficiently. I often say it's a bit like drinking coffee when you're tired. It sort of just tries to razz up the brain to work more efficiently with the brain cells that are there. There are new treatments which are in development, and these new generation treatments are designed to actually stop the brain cells from dying in the first place. So that's really a sort of treatment of the underlying disease process itself. And they're obviously the things that we hope will come to market relatively soon, so that they can, if the disease is detected really early, then they can be given early and they can slow down or ideally halt further progression of disease and symptoms.
And how would an individual access these treatments or these clinical studies to access those medications?
So, as I mentioned, these medications are not available on the market yet. They're still in the final phases of development, but they are available throughout the world in what's called big international clinical trials. And those, to get into one of those studies, the eligibility criteria is purely clinical. And if you fit the clinical criteria through a number of tests that are done to screen you to see if you match the study, and there are lots of different studies, then if you get into the study, what happens in the first instance is some people receive the active medication and some people receive a placebo or a dummy drug. And in most of these studies, following that first period where everybody is randomised to drug or placebo, at the end of that, in most studies, then everybody who's partaken in the study will then receive the active medication for a period of time.
And how safe are these clinical trials, these medications?
Well, firstly, I would like to say that these big international clinical trials are highly regulated, and they're regulated in each individual country. The medications go through various different phases. So in the very early phase, most of the sort of safety tests are done, and those are done generally with healthy volunteers. But in the later phases of the studies, then these are for people who have the symptoms for which the drug is designed to treat, and most of the safety testing has been done at that point, and it's really looking at the effectiveness of the medication versus taking a placebo. But throughout all of the studies, at all phases, multiple tests and assessments are being done, both to see the effectiveness of the drug as well as constantly testing its safety.
So I suppose the advantages to an individual with a diagnosis or memory problems is to access these new development of treatments, but are there any other advantages to participating in a clinical study?
So obviously yes, one advantage is to be able to get access to a new treatment, and actually just to say, very often in most studies you can continue taking the existing treatments and then have the new treatment in addition to that, so you're not losing out in any way at all. But the other big advantage is that you undergo the most sophisticated screening, which both provides a very thorough general medical health check, so it checks all of the things that could possibly be contributing to cognitive impairment in this instance, and it also provides sophisticated diagnostic tests to provide the most accurate diagnosis available worldwide. And then once you're in the study, you're continually being managed and sort of watched in a way that the responsibility of the people who are managing the study is to keep you as fit and healthy as is absolutely possible. So the only thing that is changing is your cognition. So it's very, very well known that in these big studies, even the people who are taking a placebo usually do much better than if they're not in the study at all, because you're being monitored and assessed continually. And often what does happen as well is that your partner, who let's say in this instance is cognitively normal, will also have the benefit and support of a whole team of experts reviewing you and looking after you all of the time.
I see we've just had one question submitted. The question is, what kind of tests do volunteers have before starting the trial?
So in this instance with cognitive studies, it will be cognitive tests. So we want to find out exactly within which cognitive range you're currently functioning, as all the different studies have slightly different cognitive ranges, because the drugs are designed to have maximum benefit according to exactly where your cognitive range is at the time of entry. The second type of test will be what we just call general physical tests, so ECG, blood pressure, pulse, weight, height, things like that. And then we also do blood tests, which will check everything from liver function, kidney function, cardiac function, vitamin levels, B12, folate, all of those things. So you're just like a sort of really sophisticated general medical health check. And then if you pass all of those, then you would progress on to MRI, brain imaging, so that's a very detailed brain scan. And then we do even more sophisticated scans, which are very specific to confirm whether or not the diagnosis is, in this instance, say, definitely Alzheimer's disease, or one of the other conditions that may be presenting in a relatively similar fashion. So all of these tests are being done to, one, check that you're fit and healthy, and secondly, to confirm as accurately as possible and as early as possible a diagnosis.
I see. And has there been any breakthroughs or any successes with any drugs in these clinical stages?
Yes, I think everybody is constantly sort of and increasingly cautiously optimistic, and as with most medical conditions, eventually the solution will be found. At the moment, there's been a lot in the press about a drug called aducanumab, which is aimed against the abnormal levels of amyloid protein in the brain in Alzheimer's. And this is a drug which currently is being looked at for application for a license initially in the US. There's also a drug called LMTM, which is against the abnormal tau protein. And this is actually in an expanded access program at the minute, so it means that it's there's been evidence that this drug looks like it could be very effective as well. But again, neither of these drugs are actually available on the market yet. But there are follow-up clinical trials for both of these drugs, which people can access today.
So do you think we are close to finding a cure?
We're certainly closer than we were before. And yeah, I think that the knowledge and the understanding about the development of medication to effectively treat this condition is advancing at an increasing rate at the minute. So yes, I think it is entirely appropriate to be cautiously optimistic.
Amazing. So for any patient out there then considering to take part in any trial, how long roughly would they have to sign up for or be involved with this recognition?
Yeah. So the studies vary in length, but on the whole, studies last between, say, a year and maybe about 5 years. So a study may be 1 year when people are taking drug or placebo, and obviously I don't know which they're taking, and then that may be followed by another year or two when they know they're definitely on the medication, or a study may be 2 years, during which time you're not sure if you're on drug or placebo, followed by a further 2 years of when you're definitely on the medication. So they vary according to the particular study, but on average between sort of like, let's say, a year and 4 to 5 years.
I see. And so can a volunteer have much of a life outside of taking part in this trial, and how often would they on average need to come into clinic?
So the answer is yes, 100%. The whole point about it is to improve life. Otherwise there'd be no point in doing it. So yes, 100%. And the sort of the studies that would have the most frequent visits would be a visit once every 2 weeks. The study that would have the least frequent visits would be about once every 3 months. And I think it's fair to say that the other studies are all sort of in between that. So probably the most common is once a month or once every 6 weeks.
I see. And whereabouts are all the clinics at Recognition?
So the recognition clinics are in central London, in sort of near sort of Oxford Street, Bond Street area. There's one in Birmingham, which is not too far from the station, just on the edge of Edgbaston estate. There's one in Plymouth, which is quite close to the big NHS Derriford Hospital, and then there's one in Guildford, which is in the research park in Guildford. And then for anybody who's listening from further afield, there's one in Fairfax, Virginia, in the Washington DC area.
And would you keep everybody's GP informed at every stage along this?
Yes, 100%. One of the things which is a prerequisite of being in the study in the UK is that we are in constant contact with your GP, so the GP knows exactly what's going on, and we also know if there's anything changing in an individual's medical status. So I don't know, if you sort of develop some other condition or something, had an accident or something like that, we know exactly what's going on in your general medical health, as well as the GP knowing exactly what's going on within the clinical trial. And I should just say, for all doctors, clinical trials are something which are absolutely ubiquitous. Every single drug that you've ever seen anywhere, whether it's just an over-the-counter preparation or it's prescribed by a doctor, has been through a clinical trial. And there's various different phases of the trial, but there is no drug anywhere, well certainly in the UK, that has not been through a clinical trial. So whether it's cancer, it's diabetes, it's a skin disorder, all these medications go through this same process. So all doctors are 100% familiar with clinical trials.
I see. And so what would you say to somebody, perhaps maybe they feel that they're suitable for one of these trials? What would be your take-home message for somebody to...
I think anybody who is interested in getting into clinical trial, as I said, the only criteria is clinical eligibility. And so if you're interested in getting into clinical trial with Recognition Health, I would suggest just pop on the website, have a look at the studies that we're doing, and just call us. We have a team of we have several teams of experts, but one team of experts will receive your call, or if you sign in on the website, we'll call you back within 24 hours and chat to you about the different studies, ask you some questions which will enable them to determine not only whether you would be eligible for study, but for which study you would be most likely to be eligible and would be the one most suitable for you.
No, that sounds excellent. And I realise you're incredibly busy at the moment, Dr. MacSweeney, so I just wanted to thank everybody for tuning in today and to find out what Recognition has to offer. And thank you so much, Dr. MacSweeney, for your time. But of course, if anyone else has any questions out there, please submit them via our Facebook or get in touch with us by any means, and we'll be glad to help. Thank you.
Thanks very much.